The Aurora Luminaries and the initiative shedding light on their humanitarian action. The Aurora Humanitarian Initiative sheds light on the activists tackling the world's most challenging humanitarian issues. The Foundation's website on its luminaries features profiles and interviews from over 100 humanitarians. The Aurora Luminaries are international and come from diverse backgrounds. While some first came into their humanitarian career after traveling, taking a job, or volunteering, many others are themselves survivors of violence or crisis, which they now seek to eradicate. Most of the Aurora Luminaries are famous figures whose names are well known beyond the humanitarian sphere, like the Dalai Lama and Malala Yousafzai. However, the vast majority work with underserved or remote populations, which keeps them away from the public eye. By profiling them, the initiative draws attention to humanitarian issues that people outside of international development may not be familiar with. What ties all of the Aurora Luminaries is their commitment to direct, grassroots activism, whether they seek to empower their own communities or work far from their original home. Through interviews and storytelling, the digital project inspires readers to find their path to bettering the world. What humanitarian issues do the Aurora Luminaries tackle? From natural disasters to conflict zones, many of the Aurora Luminaries risk their lives to support the communities they serve. Their work spans a broad range of issues that often intersect. A noteworthy example of that is Aurora Luminary and Nobel Peace Prize laureate Dr. Denis Mukwege, whose work addresses humanitarian issues such as lack of accessible healthcare, gender-based inequality and violence, and wartime sexual violence. The Congolese gynecologist originally founded the Panzi Hospital in Bukavu as a place to treat female patients suffering from complex gynecological conditions. He expanded on that work with the Panzi Foundation, an organization that advocates for women's rights and the eradication of rape as a weapon of war, while also providing psychological and legal support to victims. Aurora Luminary Marguerite Barankit's work also tackles several issues at once. Through her shelter-turned-NGO Maison Shalom, she was able to save approximately 30,000 children from both sides of the conflict during the Burundian Civil War. After getting expelled from Burundi, Barankit and her team reopened Maison Shalom in Rwanda, where they continue to provide health care, education, and support for children orphaned by violence and ethnic conflict. Physicians as humanitarians. If there is one group that may be overrepresented amongst the Aurora Luminaries, it's medical doctors, albeit of many different specializations. Dr. Mukwege is not the only luminary to open a hospital and provide life-saving care. Dr. Tom Katina, 2017 Aurora Prize laureate and current chair of the Aurora Humanitarian Initiative, is the only doctor permanently based in the Nuba Mountains of Sudan, performing surgeries and providing healthcare in the remote, war-ravaged region. South African pulmonologist Dr. Emmanuel Taban was a former child refugee who, through missionary aid, was able to become a successful physician. He developed an innovative method of extracting mucus from the lungs of COVID-19 patients experiencing severe oxygen deficiency. Supporting women and girls. The work of many of the Aurora Luminaries focuses on women and girls who face additional disadvantages due to their gender. From ending domestic violence and forced marriage to providing education or healthcare, these activities are at the intersection of providing humanitarian aid while fighting for women's rights. Virginia Kunguni is a journalist and the founder of Girls Arise for Change, an organization that works with adolescent girls who are victims of abuse. The Aurora Luminary, herself a rape survivor, developed the organization to work directly with girls between the ages of 12 to 22. The organization works in tandem with community leader to help its young beneficiaries develop skills to help them escape poverty, while also providing direct help through meal programs. During the COVID-19 pandemic, reaching the beneficiaries directly became a difficulty. The organization pivoted its efforts towards distributing masks and hygiene products, but Kunguni still worried that being kept away from education forced many young women and girls into unwanted sexual activity and forced marriage. From Pakistan, the Basum Adnan founded Kwendo Jirga, a council of women that helped bring justice to thousands of Pakistani women, especially victims of violence. The work of other activists, like 2022 Aurora Prize laureate Jamila Afghani, focuses on educating Afghan girls through her organization, despite Taliban bans. Acts as innocuous as opening schools and advocating for victims of domestic violence have led to many of these Aurora Luminaries receiving death threats. Crisis response and reconciliation in times of war. By improving social cohesion, Aurora Luminaries save lives and potentially even prevent future conflicts. Rwanda human rights activist Aloys Uwimana is most known for risking his life during the Rwandan genocide by helping 104 Tutsi cross over to the DRC, thereby saving their lives. Today, in his role as a preacher, he advocates for unity and reconciliation. In Yemen, peace activist Hadi Juman acts as a mediator in the ongoing civil war. With a team of volunteers, his negotiation efforts facilitated evacuation efforts, aid delivery, prisoner exchanges, and the return of bodies from the front lines to grieving families. Beyond providing immediate relief and closure to those affected, Juman's efforts could play a small but important part in a healthier end to the conflict one day in the future. The website also serves as a memorial for humanitarians who have passed away. They include Gabriel Storing, the founder of IACT who dedicated his life to working with refugees displaced by genocide, Dr. Hawa Abdi, physician and human rights activist whose Hope Village offered shelter, medical care, and education to over 90,000 displaced Somalis, and Edmund Koroma, a former teacher from Sierra Leone who dedicated his life to supporting the recovery of vulnerable children including former child soldiers who had suffered from the country's civil war. This is just a small glance at the many dedicated individuals honored as Aurora Luminaries. The Aurora Luminaries represent a powerful force for change across sectors and borders. Their work is a testament to the transformative impact of grassroots action, demonstrating that even the most daunting challenges can be overcome with courage and commitment.